If you are about to have a knee replacement surgery or you have already had a knee replacement surgery and you're wondering if squatting is safe for you, you are in the right place. This video is going to talk about what squatting really is, if it is safe to do after a knee replacement, and what you need to know about your knee replacement surgery to make sure your recovery is the quickest it can be. Now let's talk about what squatting really is to begin with. People think that squatting is a really complex movement that has a lot of different things going on. In all reality, it really is. But when looking at the squat in itself, we essentially need to bend our knees and our hips at the same time to lower ourselves down to the ground, and then use the same muscles to get us all the way back up into our starting position. So although it may seem like squatting is just for somebody who's very high into athletics or other sports, it is also crucial for individuals who are trying to remain the most independent in their daily life. Squatting is a movement that we do numerous times throughout the day, specifically when we get up and out of a chair. So although the movement is really crucial for daily life, does that still make it safe, especially after a knee replacement surgery? Since squatting is a crucial movement that we need to do every single day, yes, it 100% is safe for you to do after your knee replacement surgery. In fact, if you don't practice squatting, you will likely lose the strength and independence to do movements like that on your own. Because of this, it is very crucial to actually practice this squatting pattern through numerous different ranges of motion. There are some things to consider though when squatting after a knee replacement surgery. The first thing to consider is some of the physical limitations you will likely have from your doctor or physical therapist. You should stick to these recommendations and only start adding in some light squats when it's okay for you to do so. Your physical therapist or doctor will likely have this outlined as a 6, 8, maybe even 12-week barrier. Once you get cleared to actually squat, you can add in some squatting movements for yourself. So because of that, we can look at a few gentle ways to actually squat and strengthen the knees, hips, and ankles in a way that's a little bit easier for yourself. Let's take a look at some of these movements. So when looking at an ideal squat pattern, we want to really try to get all the way down as far as we comfortably can without pain. Over time, we want to try to shoot to get to that full range of motion squat, otherwise known as ass to grass. But of course, after a knee replacement surgery, this might be a little difficult to get into. And because of this, we can start out with some half squat holds. This is a great exercise to build up your overall squatting pattern, strength, and stamina, as you will slowly bend your hips and knees at the same time, holding for just a second and then coming back up. Try to keep equal pressure in your feet through the entire way. And in addition to that, we can also try doing some wall sits. This one, you're going to have your feet about a foot from the wall, and then you're going to bend your hips and knees a little bit. This is going to place a little bit more emphasis on your knees, as you will slowly sink your body down, try to hold without moving at all, and just making sure you are breathing throughout the movement. To make this more tougher, you can go lower, of course. And in addition to this, another option is doing wall squats. Kind of the same concept, except you're actually going to be moving throughout the entire time. So you're not going to be holding the position. You're going to be slowly going down as far as you comfortably can, ideally about 90-degree angle, if possible at all. And another way to do this is with a stability ball. Link that into the description. Putting that ball behind you can make this a little bit easier. It's a little more smooth, not so harsh on your back. And on top of that, you can also add in some assisted mini squats. This is kind of similar to the squat hold we were doing earlier, but we're adding a full actual squat. So we're not just holding that isometric position. We're going through the full range of motion. This is a really good build into a full body weight squat. Ideally is what we would shoot for in time, but especially after that knee replacement surgery, this is a great option. Last but not least is some slantboard squats. Slantboard in the description if you want it. That is an excellent piece of equipment. This thing has saved my knees. It will allow you to squat in a very deep position, putting your knees in a position that will ultimately get them a lot stronger over time. And you'll probably notice it's pretty easy to stay upright. I would highly recommend trying out the slant board. Super great. And also too, if you can't do this all the way, just try to go down as far as you comfortably can. Now the main goal here is to practice a lot of these movements in ways that don't cause any pain and will increase the overall strength of your knees, hips, and ankles. By following one or even a few of these daily, you will hopefully have a knee that is bending pain-free with no issues at all. And if you want to continue to get stronger after your knee replacement surgery, make sure you subscribe to our channel as we help individuals inside the gym and become healthier in life, regardless of their current abilities. And if you don't want to do that, I think you would enjoy this other video I picked out just for you.
Tell me you know